Yeah, he's doing the exercise and the diet side of things pretty well, but
he's clearly got a lot on his plate. He's 38. He's a secondary school teacher. Pretty full on, busy life, training quite regularly, sleeping pretty well. He's reduced his alcohol intake. So actually, it sounds like he's doing the right stuff, but fatigue's low, not feeling great, and kind of just a bit sort of low down, low mood, and not much of a libido either. The one thing then, actually, that he forgot to mention, they're trying for the second child, and after 8 months there's been nothing happening. That's probably a bit of a red flag for him.
Well, that may bring a consideration of what type of treatment he would consider, because so we're going to do some case studies now. Luke's going to give me some information about some patients. We're going to think about what the factors might be in their diagnosis. Just to add that these are all fictional scenarios. None of this is real people. We're not sharing anyone's clinical data.
No. So, Rich, first up, we've got, I'm going to call him Bob.
Okay.
He's 38.
Yep.
He's a secondary school teacher. Pretty full on, busy life. Training quite regularly, 3 times a week.
Yeah.
Sleeping pretty well, but fatigue's low, not feeling great, and kind of just a bit sort of low down, low mood, and not much of a libido either.
Okay. So it sounds like there's one aspect that's good about this already, the fact that he's training, exercising. So there's that element of a good. Mentioned their diet was okay as well.
Yep.
And yeah, so I think the next step would be, given that the lifestyle side of things sound like they're okay, be worth getting some blood work done and having a check of that. So do we have any information on what his baseline levels are?
Yeah, we do. So he, and also just worth mentioning, he's actually, the lifestyle stuff we were talking about there, he wasn't doing that, and he has been. So over the last 6 months, he's brought in his training, he's reduced his alcohol intake, kind of the stuff that I'd be telling him to sort out as well before having these kind of conversations. And so actually it sounds like he's doing the right stuff. He has been on SSRIs, but stopped them back in 2022, so it's been a while since he's done those. So yeah, vitamin D, 48, suboptimal but not amazing, not on borderline. PSA 0.9, hematocrit 44, HbA1c 38. So all looking pretty good, I would say. Yeah,
so not diabetic. Like you said, the vitamin D is a little bit on the lower side, but that's probably common for most people in the UK, apart from today, when it's like 32 degrees. Yep. But the majority of people in the UK are going to be deficient in vitamin D, especially between October and April, when the angle of the sun's not sufficient for us to get enough, absorption through the skin. Vitamin D deficiency, if corrected, can help to improve some hormone parameters. So that's certainly something for consideration, but everything else sounds fine.
Yeah, and with the vitamin D, it's a super easy, cheap one to do as well, right? I pretty much, with my clients, we get most people to take one because in my experience, a lot of guys are deficient because of the exact reasons, right? We don't get enough sunshine unless it's a heat wave, let's say.
I think the important thing for me with the vitamin D is to get it tested, then start with something like 1,000 IUs daily. Yeah. Then get it tested again and see where you sit.
Well, straight to 10,000 IUs. Yeah.
Because you can run into problems if you've got too much vitamin D in your system. It's not great. There is such a thing as vitamin D toxicity. So yeah. Get it tested, see where you sit, 1,000, move up incrementally. So yeah, that's sounding, apart from the vitamin D being on the lower side, not too bad.
The one thing then, actually, that he forgot to mention, and he's now mentioned, is that they're trying for the second child, and after 8 months there's been nothing happening. And that's probably a bit of a red flag for him.
Yeah, absolutely. So if we were thinking about the issue being predominantly with Bob, then what I would want to look at next would be his hormone profile. So if there's issues with conception, let's have a look at his luteinizing hormone and his follicle stimulating hormone. Of course, symptomatic-wise, generally, it's the sexual symptoms that present first with testosterone deficiency, and he's mentioned he's got low libido as well as the fatigue. So yeah, if there's any information on his hormone profile, that would be great.
Cool. Well, he's got his test done now, and what is coming back at total T is 11.2, free T 0.19, SHBG 42, LH 4.1, FSH 3.8.
Yeah. So the LH and the FSH are within range. No problems there. The testosterone level, that if we're thinking about, there's this interplay between, say, the NHS diagnostic threshold and what the British Society of Sexual Medicine, the international guidance is, that recommend looking at considering levels under 12 nanomoles per litre. So the main thing for Bob is that yeah, somebody might look and say, oh, the testosterone level's not too bad. It's his free testosterone is quite low. So anything under 0.225 would be considered low within the diagnostic range. So the SHBG is within range. It's not too high. It's not too low. I don't like to see the SHBG being too low. People think, oh, if you've got a low SHBG, that's going to be good because you're going to have more free testosterone. That's correct. You will have more free testosterone. But generally, if SHBG is very low, it's indicative of more metabolic dysfunction.
Yep.
And when you've got a normal ranged SHBG, that's what I like to see. That's good. It's necessary to transport the testosterone around your body. When you've got people with really suppressed SHBGs, then it can be difficult for them to feel the benefits of, say, testosterone treatment. Yeah, looking at that, I would say that Bob might be a candidate for a trial of treatment. The only other thing is that we would need a comprehensive blood panel doing just to rule out some other things, because thyroid function, you know, if he was hyperthyroid, that might mirror some of the symptoms that he's experiencing. Given his job as a secondary school teacher, I would imagine that's pretty stressful, you know, kind of, yeah, he's doing the exercise and the diet side of things pretty well, but is there a stress component to this? And looking at that, I wouldn't expect him to be infertile from those lab ranges. So it might be worth having a chat with a fertility expert, maybe a joint appointment with him and his partner to see whether there's any problems there. In summary, for Bob, he may be a candidate for considering testosterone replacement. Both of his total testosterone and free testosterone are under the diagnostic threshold. He's got one of the main symptoms, as in sexual dysfunction, along with some of the other continuum of symptoms we would see around fatigue and lack of drive. He has been doing things right from a lifestyle perspective for the past 6 months, which would hopefully rule out functional hypergonadism. Yeah, I think pending a full blood panel just to make sure there's no differential diagnosis, he may be someone that could benefit from treatment.
For sure. And I think the other thing with him is that although he's doing a lot of the lifestyle factors, I think a good conversation with him about how he's managing his stress and what he's doing with his workload, because he's clearly got a lot on his plate.
Yeah.
And also the fact that him and his wife are trying for a baby,
that
adds a layer of stress and emotional stress that you need to manage as well, right?
Well, that may bring a consideration of what type of treatment he would consider. Because, of course, if he was to just go onto injectable testosterone or gels, there is a chance that it would have a negative effect on his sperm production. But there are alternative options that he could consider that may support his fertility or at least not hinder it until his family's complete.
Yeah, I guess that's also why you want a full panel to check everything out as well, right?
Absolutely.